When families first hear that their child has serious heart disease, it's like a moment of terror. And probably for many, maybe all, it's the very worst news they've ever heard. Every family handles it a little differently, but there's always that overlay of now what are we going to do and who's there to help us.
We found out about Holton's condition at the 20-week ultrasound. It was hypoplastic left heart, and they also told us this is the worst possible diagnosis it could be. Those were her exact words. When we were told that, it seemed like a death blow. It was terrible.
I left that appointment in complete tears, just thinking there was absolutely no hope whatsoever.
And so then we went to Dr. Frazier and Dell Children's, and they gave us hope.
One of the things that's really unique about our institution is it's a coming together of Ascension and UT Dell Medical School to develop a hospital program that really caters to the needs of children with congenital heart disease, not only here in our community, but broadly across Central Texas.
A facility where everyone is there together, everyone is working together, they're not having to bounce all over the place, and that's something we're very proud of.
Austin really needs a place for complex cardiac care because families would otherwise have to be separated from their support systems to go to other major centers across the United States. The opportunity to build a program from the ground up and really try to focus on the things that get lost in some larger programs. And that, in part, is really being able to personalize the care and the experience for the patient and the families.
The simplistic but passionate view was to surround the patient all the time with the very best possible expertise. The guiding star has got to be what's best for the patient and the family.
We'll all get together in the room and discuss exactly what we're going to do. We're going to acknowledge the gravity and the emotional part of that separation. And we're going to take time to do it. I think we stop in the hug zone and acknowledge the moment because it is an important moment. There is some feeling that the family may never see the child again. And so it's important to me and to my team to make that moment important and count.
When a baby gets here or is coming, it's a swarm of dedicated personnel that have only one purpose, and that is to rescue the baby.
So preparing for a smallest ever, youngest ever, most challenging case of an 800-gram, 28-week-old child, I made a custom inch-by-inch circuit for that patient.
He was less than 24 hours old, and we were able to place a Berlin heart. He's the youngest ever reported.
I think it's important to be a risk taker and a warrior and have the spirit to take on things that are difficult. Not everyone wants to do that, but that's what you need to be successful in an endeavor that is so serious and difficult.
Our purpose is to offer something to people who are suffering. And so pushing the margin, we're going to offer somebody something, and that's what we think is the right thing to do.
So here at Dell Children's, we really do have a unified approach to care where we can take care of children from the time that they're born through later life, which provides a measure of comfort for both the families and the staff.
It's always been hard for me to go to my appointments about my heart because I was always scared of this.
I always ask, is there something specific from the patient that they're worried about so that they feel like they've been heard?
Seeing your 3-day-old son going into an open heart surgery is overwhelming and scary, but I was completely comforted by the fact that we were at Dell Children's. It means hope. It means a fighting chance an opportunity to make it. They saved my son.
It's really kind of mind-blowing to be in a job where you know that you did save a life that day.
If we continue to put patients and their families first, we can't go wrong.